my name is Sarah Clark, and today we're going to be covering the integumentary system. That covers the skin, the scalp, the hair, and the nails. And we're going to be using inspection and palpation for this assessment. This is Kimmy. She's agreed to be our patient again. So the first thing I'm going to do when I'm inspecting her skin, ideally in a clinical situation you would inspect all of the skin, but for this purpose we're going to keep our patient model here clothed and just inspect her arms and her head and her legs. First thing you're going to do is just look at all the skin you can see, look for any changes in pigmentation, see if you can sense any distinct odor, anything like that. You can see a slight rash here on Kimmy's arm. And then look at the feet and legs as well. And then on the neck and the chest and the skin there. And you're inspecting for any color changes, any rashes like I mentioned, any skin breakdown. If you have skin breakdown, you can stage it in 4 stages. The first stage is where there's no actual tear or interruption of the skin. The second stage is where the skin is partially interrupted, like a small wound. The third one is when it starts to go into the tissues beneath the skin. And then a 4th stage is when it starts to go deep into the muscle or the bone tissue. But Kimmy doesn't look like she has any wounds or lesions that would be past a stage 1. And then when you palpate the skin, you're also palpating for texture, especially on the hands and feet. The texture is going to be a little bit thicker, a little different, but everywhere else the texture should be smooth. So if I'm feeling on Kimmy's skin, most of it feels very smooth. It's a little thicker. She's got some calluses on the heel, a little thicker on the soles of her feet. And we'll look at her arms, nice smooth texture there. Same thing, a little thicker on the palms. And then if you look at where Kimmy has a rash here, it is a little bit thicker skin, a little bit different texture. As Kimmy calls it, it's chicken skin, is that what you call it? But you can see and feel a different texture in that rash as well. The temperature when you're palpating should feel nice and warm. If it's cold, it means it's not getting as good of blood flow as it should. But all of your extremities feel equal warmth to the main parts of your body, so that's good. You also want to assess the skin turgor to see if they're dehydrated or not. So what you would do is just like grab their hand and you would pinch a little bit of their skin between your 2 fingers. And if it holds its shape, it's because the skin is very dehydrated. In a healthy person though, the skin should be nice and taut and it will quickly go back to its normal shape, which Kimmy's did. So she's very hydrated. The next thing you're going to palpate for is any edema or swelling. If you have severe edema, it could be like pitting edema, where if you pushed in the ankle and pulled your finger away, you'd leave a divot. But I didn't know any swelling on Kimmy when I was palpating. Next, you're going to palpate or inspect the scalp and the hair. And you're looking at the color. I'm going to take my gloves off. We're okay with that? Okay. You look at the hair distribution, the color, and some of it might be hard to tell. Like if a patient just has naturally thin hair, or if they're losing hair, so you would just ask your patient, like, have you noticed any change in your hair falling out, like any thinning, any change in color, anything like that?
Everything's been good.
Okay, so you can always assess if something's normal for the patient by just asking if they've noticed any changes. If the hair is thinning, it could be a result of like an iron deficiency. A couple other things can cause problems with hair loss and stuff as well, hormonal changes. And then you want to inspect, make sure there's no wounds or anything in the head, inspect the head shape, no bumps or masses or anything, and palpate as well to make sure there's no lesions or sores. A little bit of that rash is noted on this far side of Kimmy's neck as well, but nothing as far as the scalp and hair seems abnormal. The last thing you want to assess is the nails, and first you're going to inspect by just looking at each of the nails on both hands and both feet. And the nail bed should be translucent. You should be able to see through the nail, and the skin underneath should be slightly pink with white at the very bottom. You want to assess the shape and the this helps you assess the self-care that a patient puts into based on their nails. It sounds very vain, but it's actually a really good way to assess how much self-care they use. If their nails are like bleeding or cracked or dry, or their fingernails are long, those can be signs that they're not putting in as much care as they should. You can also assess for other things like oxygenation by looking for clubbing in the fingernail. The nail, between the nail bed and the nail, should be about a 160-degree angle, which is relatively flat here. If there's a big rounded base of the nail bed, then it would be indication of clubbing, which is chronic hypoxia, like lack of oxygen would lead to clubbing in the fingernails. So just by assessing fingernails, you can check out their self-care, you can assess their oxygenation, things like that. As people age, they generally can get some lines going across the nails, or different deficiencies can also lead to discoloration of the fingernails as well. The last thing you want to do is check the capillary refill of all the extremities, and you do that by just pressing firmly at the nail bed for 2 or 3 seconds and then releasing and counting how long it takes for the color to come back to the nail. So it should be less than 3 seconds. That one's like 1 second. Try it on this hand, about 1 second. And you do it on both the feet as well. And Kimmy has really good capillary refill on all 4 extremities. And the nail beds all look really well taken care of, no clubbing or anything like that. And that concludes our integumentary assessment.